difficulties at some point in the progression of the disease. So I worry about hydration in you all, especially, and because you're boxing. So when I first started working with this group, one of the things Pat installed was those, like the beverage. Can those come back yet? Are those back?
Yeah, we still have them.
With COVID? Oh, okay, good.
Yeah.
Oh, hang on. I had to consent to the recording and then it kicked me off. There we go. So that was actually as a result of the class, right? When we were talking and saying, all of you are probably not drinking enough when you're here. So today we're going to talk about that. And then next class in June, we will talk about protein intake, which we touched on briefly in the weight loss lecture. But I'm going to talk about protein specifically because that has to do with your muscle retention and your muscle strength, as well as your immunity. And a lot of you have the timing issue with some of your medications. So that'll be our next class. So today for hydration. So essentially the kind of simple definition of dehydration is when more water is exiting your body than enters it. And so we're constantly losing fluids, through tears, sweat, urine, feces, just throughout the day, you're constantly losing fluid. So it's a little bit, and I'll get more into needs in a minute. It's kind of a generic thing out there, like 8 glasses of water a day. That's not necessarily true for everybody. And we'll talk about why that is and some other things that you can maybe do, because I think that one of the reasons that people tend to not drink enough actually is because the recommendations sometimes feel so overwhelming. And I've had people say that to me, like, there's no way that I could drink 8 glasses of water. So I just do what I can. But when we really break it down into how you could meet your fluid needs, it usually seems less overwhelming to people. So as we age, as I said, your risk of dehydration increases. And this is related to a lot of different reasons. One is an actual decreased sense of thirst. The chemical connection between your brain actually just slows down in terms of like triggering that thirsty sensation from your brain. So even if you actually do need fluids, you are not going to kind of sense that as much as we age as when we did how we did when we were younger. So there's not an exact so they think it's because of that pathway, but this true, like 100%, this is why that decreased sense happens. They really actually haven't figured that out yet. So we believe it's because of that signaling mechanism, but there is actually still some research going on as to why specifically that might be. Also, there is decreased circulating fluid volume in our body as we age. So the water level in your body is less in older adults than it is younger adults. And so if you're constantly carrying less circulating fluid, then the risk of you becoming dehydrated is higher. A lot of medications that we get on as we age can actually increase our fluid losses. So any type of blood pressure medication, diuretic, a lot of those medications cause you to excrete more fluids. And so that's actually kind of a catch-22. I see that in people. So they're like, well, I'm on a fluid pill. So I don't drink in the second half of the day because I'm on this fluid pill. And if I drink in the second half of the day, then I'm up all night having to go to the bathroom, which I totally understand. And sleep is certainly important and not wanting to get up in the night. But the problem is that those medications will pull fluid from your system, whether or not you're drinking enough. So that's the intention. It is going to pull fluid from your circulating system. It's going to pull fluid from your extracellular space, which means like outside of your veins. It's going to pull it into your veins and it's going to circulate it and make you excrete it. So when you are on a fluid pill, you actually need to make sure you're drinking enough, if not a little bit more, to make sure you don't get dehydrated. And I know that doesn't kind of seem like common sense. So sometimes I have to talk people through why that is. But you definitely are at a higher risk of getting dehydrated if you take any type of hydrochlorothiazide or Lasix or some other blood pressure medications that have diuretics in them. So there's excess fluid loss related to medications. There's also excess fluid loss related to certain medical conditions. Things like if you have any type of wound, like an open wound from surgery or just from bed sores or a lot of skin tears or anything like that, that actually increases the amount of fluid that your body's losing. Kidney issues, also, if you're somebody who has renal disease, sometimes we get disruptions in the amount and frequency of urination. So you might be losing too much fluid related to that. In addition, if you have any type of burn, excessive sweating, certainly GI issues, vomiting, diarrhea, all of those things significantly increase your fluid needs. Burns especially are something that is really, your fluid needs double actually when you have a certain percentage of your body if it's burned. So any type of wound like that, you're losing a lot of fluids. So we need to make sure that we're repleting those. And so all of this is important because, as you probably know or have heard, so 75% of our body is water. And so maintaining those levels is extremely important to make sure that all of our organ systems are working the best they should. So we've all heard about people getting into the hospital because they're dehydrated. When that happens, that usually means they're severely dehydrated. Slight dehydration still causes physical symptoms, but usually they are minor enough that we walk around with them. So there's a certain percentage of the population that is kind of borderline or slightly dehydrated, just chronically all the time. And they probably have symptoms, but it's not bad enough that they feel like they need to go to the doctor, right? So things like dry mouth, a little bit sleepy, like just feeling tired, kind of lethargic. All of those can actually be some of the first symptoms of dehydration. And then as the dehydration becomes worse, your symptoms obviously worsen and ultimately can lead to death. Our body will dehydrate. If we were to have no fluid intake for 3 to 5 days, that actually would lead to death without intervention. So whenever I have someone who's sick and they always say, oh, well, they're sick and I just can't eat. Not eating for a week is okay. It's not great, but it's okay if you're sick, but you cannot go without drinking. So we have to always figure a way to hydrate you no matter what. So the progression of those symptoms that you would see, some of the first things as you're going from that kind of borderline dehydration into actually being dehydrated are the color of your urine. So urine should be like pale yellow, no real smell to it. So as soon as you are getting into urine that is cloudy, that has an odor, that is dark, getting into like golden and then all the way to like tannish, brownish tinged, that means you are not drinking enough. So that is one of the first symptoms that we look for. Some people take medications that turn their urine bright yellow, like B vitamins actually will do that. That is not a sign of dehydration. That's actually something different. But it's more when our urine's getting dark colored that it becomes like suspicion of something going wrong. Another thing is muscle weakness. So it goes along with that lethargy, but just kind of feeling a little bit dizzy, like you have to sit down. That's a common symptom. Headaches are a very common symptom of being dehydrated. So these are some of the first things to look for. And that means that you need to be drinking more, especially that day. So as soon as you see these symptoms, you need to intervene immediately. If you let these go within a few days, you can actually be pretty sick or develop other types of complications. And so think about it when I said that as we age, we don't necessarily sense thirst as quickly. So by the time we actually feel thirsty as we age, a lot of times we're already in that borderline slightly dehydrated phase. So don't wait until you feel thirsty to drink something. All right. So once we get, if we were to let it go into like very bad, severe dehydration, your body will actually shift fluids to areas in your body that need it most. So fluid that you do have circulating will be redirected to the crucial, critical areas of your body. So your heart, your blood, your brain. But that means that they will not be prioritized to your other organs, like your kidneys and such. It does that as a protective mechanism, but that is why in severe dehydration, I've had people in the hospital, when I worked in the hospital, severely dehydrated that were in kidney failure. And that's because their body had shifted fluids away from those organ systems into the main organ systems required to live. So loss of even 10% of your body's circulating water leads to all of these symptoms that I showed here. And obviously they grow in severity as the dehydration worsens. So some of these losses, when we're saying loss of 10%, it can be related to excess excretion. So it can be because you're sick, or because you had diarrhea, or because Pat worked you really hard at the gym and you sweat a lot more than normal. But the other part of that is that you're just not drinking enough. So when we talk about loss, we're talking about a combination of the water, the fluid that is excreting your body, and the amount of fluid that you're taking in. So because of that, that's why the severe dehydration can happen in just a couple of days. Lack of sweating is also a pretty common one. So if you are working pretty hard at the gym and you find that you are not sweating, that actually can be a sign of dehydration, because, as I said, your body will prioritize where those fluids are going. That can be very dangerous, because sweating is our body's way of cooling itself. So when you are working at the gym and you sweat and the sweat gets on your skin, that then creates a cooling mechanism for our body too. So that's a way that we lose heat. If you're not sweating, you run the risk of overheating. And so that can be very dangerous, actually, not to sweat. And so, as I said, you don't sweat because your body will stop you from sweating. It'll stop you from losing more because it realizes, oh, we don't have enough to give this system to be able to sweat. Sunken eyes are another thing, because water will actually be diverted away from your eyes. In that lack of sweating, the heat injury that can occur, one of the symptoms of that is like cramping. So if you cramp a lot when you are exercising, that can actually be a sign of poor hydration. A lot of people always immediately say, oh, I need to eat a banana. My potassium must be low. But one of the reasons that people's potassium gets low is because you're not drinking enough, because you're poorly hydrated. So most of the time, it's not really as related to potassium as it is that your fluid level is just not high enough. So cramping can be a symptom of that, but you can obviously ultimately get to heat exhaustion, heat stroke. It can be very severe. And over time, it actually will progress, and you will get dry skin. You will get chapped lips. If you've ever been dehydrated or seen someone in the hospital from dehydration, it's beyond like winter type chapped lips. It's an actual like layer of dry skin around the entire perimeter of their lips. And usually in the corners, you will get cracking. And that's just because of a lack of fluid around in your oral cavity. So dry skin, chapped lips. One way, I'm not sure if I can really demonstrate it well on Zoom. So one of the things when I worked in the nursing homes that I used to work in, if you take this little area right here, so like right here in this like crack, and you like pull up on your skin like this, your skin should like bounce right back, right? It should sink right back down. Now, as we age and our skin is a little looser, you might see a little bit of like, it takes a second to go back down. But if it stays up like this, fairly elevated after you let go, that's called tenting. And that is a symptom of dehydration. Essentially, it means that the water level under your skin layer is not enough to pull your skin back down quickly. So that's something that we always used to look for in our patients when we were assessing them. So dry lips, chapped lips, cracked corners of the mouth, skin that holds and will hold up. All of those things are when you're progressing from mild towards moderate and severe dehydration. Low blood pressure is another one. Oftentimes, one of the symptoms that lands people in the hospital from being dehydrated is they pass out, or they kind of collapse sitting down because their blood pressure drops quickly. That can be related to poor circulating fluid volume and actually low blood volume as well. You also will get an increased heart rate, which obviously can be life-threatening. And that is because your heart is working harder to try to circulate the fluid it has throughout your system. It also will lead to fever. And that is because of your body's decreased ability to regulate its temperature. We need adequate fluid for, our body wants to be 98.6, right? And it will do everything. Everybody's a little bit different, but in general, it will work its very hardest to keep you within that 1/10 of a degree as hard as it can. And so if it can't do that well, you will start to get a fever if your body can't cool itself down. Delirium is another very common when we're getting into severe dehydration. A lot of times people will forget where they are, who they are, especially in the case if somebody already has some cognitive issues going on, if they have maybe the beginning of Alzheimer's or the beginning of dementia or anything like that, and they are on top of that slightly dehydrated, they can act extremely impaired, completely confused. Very, very severe dehydration that would also lead to seizures, unconsciousness, death. The seizures is actually what occurs related to that imbalance in electrolytes. So when I say that your potassium levels impacted by your hydration, that's why. And when it gets too low, it actually will cause seizures. You also at this phase, I didn't list here, but that's when you will get your kidney issues, renal failure. But chronic, kind of mild dehydration also contributes to any of you who have a tendency to get kidney stones. Hydration is a big factor in helping to regulate kidney stone prevention. Also urinary tract infections. The most common side effect that I have seen in older adults from not drinking enough is chronic UTIs. And that's because if you are not drinking enough, the fluid's not flushing through your system enough, therefore your urine sits in your bladder for too long. And the longer it sits in there, the longer it has to grow bacteria. Once you get a high enough bacterial load in your bladder, you have a urinary tract infection. Once you get them, people tend to get them over and over and over, right? Urinary UTIs become chronic in some people. And a lot of it relates back to you just aren't drinking enough. So in order to be diagnosed with it, your doctor would do kind of the physical things that I just talked about, but they also might do a blood test in that they're looking to check those electrolytes. When we do something called a basic metabolic panel, we're looking at your sodium and your chloride and your potassium levels and your creatinine levels. And we can tell pretty quickly by looking at those if you're drinking enough. It takes about 2 seconds for a dietitian or a nurse or a doctor or PAP probably to look at labs and say, oh, this person's dehydrated. So that's one of the first things that they probably would do. They also would probably check a urine analysis because if someone is dehydrated, they're going to have that higher bacterial content in their urine. There also might be some cognitive tests done because of that tendency towards delirium and confusion in severe dehydration. So in the blood tests, if your doctor tells you at some point that you have high potassium or high sodium, a lot of times that can mean you're not drinking enough. So just something, I know everybody now has the portal, right, from your doctor where you can go on and see your own lab results, which I think is great. But then if you don't really know what to look for, then I'm not quite sure how that's helpful. So that's what you look for. If your sodium is high or your potassium is high, that usually means that you're not drinking enough. So check out your last labs and look for that to see what that showed. It also can indicate altered kidney function. So it doesn't always necessarily mean that you're dehydrated, but it is one of the kind of quick ways that we can say, oh, maybe. In the urine analysis, so they're looking for bacterial content. They're also looking for an elevated level of ketones. So if in your portal you have a urine analysis in there, it will say like positive for ketones or negative for ketones. Those are indications of hydration. Treatments is we need to get your fluid level back where it should be, right? That's the main treatment. So primarily, we're going to focus on doing this by mouth, getting you to drink enough, unless we're in a case where it's severe enough dehydration that we need to put it right intravenously into your circulating system. So in that situation, you would have to get IV fluids. if you're to the level where you're at the hospital or you're at the doctor or you're in the ER for dehydration, they're not going to take the time to have you try to drink enough. They're going to hook you up to an IV. But if I'm in your house and we're chatting and what have you, or you're in the gym and I notice that you're looking a little peaked maybe, I'm not going to say, oh, go get an IV. We need to figure out a way to get some more fluids. Another big thing is figuring out why somebody is becoming dehydrated. And that's something that I think oftentimes isn't done. Medically, we tend to treat dehydration, but not necessarily always do a good job coming up with a plan of, okay, how did this happen so that it doesn't happen again? So that's always something that I really like to make sure with people is that we're figuring out why it happened. Is it that you're not thirsty enough? Okay, then let's come up with a plan of set a reminder on your watch, set a reminder on your phone. Every time it goes off, we need to drink something. There's strategies that we can come up with, and that's really important because the more, as I said, the more dehydrated that you let yourself get, the more of those other symptoms you're going to chronically have. So think, was it due to medication you're on? Was it due to just not drinking enough? Any of these things. So how much is enough? This is individualized. So last session, when I talked about how many calories you need and said that's individualized, fluid intake is the same. In general, we are going to say that you need, when I'm assessing somebody's fluid needs, quick and dirty way to do it, you would take your weight in kilograms. So to figure that out, we take your weight in pounds, divide it by 2.2. So we've done that before. And then you're going to multiply that by 30. And that will give you how many milliliters you need in a day. To convert that then to ounces, you're going to divide it by 30. So it's a two-step process. Another way sometimes that we will do it, especially in people who are very thin or very small in stature, is 1 milliliter per calorie that you consume. So sometimes we'll do it that way if it's someone who's very small. In general, for 98% of the population, we never are going to say your fluid needs are less than 1,500 milliliters a day. That's generally minimum what the human body needs, despite your size. Everybody needs at least 1,500. Most people will need considerably more than that, especially if you're a larger person, taller, heavier. Your fluid needs could be up to 3,000, 4,000 milliliters a day. So that's kind of figuring out your fluid needs. And in the same way that we said, okay, well, what does that mean though, if you don't know how much you're actually drinking? So in the same way that if we think hydration is an issue for you, last time I talked about keeping a food log to figure out how many calories you're consuming a day. If hydration is the issue, I'm going to have you keep a fluid log and figure out how much you're drinking in a day so that we can say, okay, this is what you're taking in. This is what I think you need. We're not even close. How do we get there? And so the other thing, so one, it can tell you where you're at. And then two, it also helps you figure out the times of day where you tend to drink more and then other times where you tend not to. So what are your best times of day? What are your worst times of day? If you're somebody who's on one of those fluid pills and you don't want to drink after 7 o'clock at night because you don't want to have to get up to go to the bathroom, I understand that. And I'm not going to make you drink a gallon of fluid at that time of day, but we have to make that up somewhere else. So you can't say, oh, well, I just don't drink after 7 o'clock and have that decrease your intake. We have to figure out, okay, if you're not going to drink after 7 o'clock, where else in the day can we get that fluid in? So it's important to look at those times of day. So journal tracking all fluids, I would say minimum for 3 days so that you can get kind of an average of what you would consume. And so look at those times where your intake is worst and try to problem solve. Why is that? Or especially if you're someone who struggles with some level of incontinence, and there's certain times of day where you're going to be out and about. All of that can be accommodated and still meet your fluid needs. It just comes up, we just have to come up with a plan for it. Figure out what you will drink. So one of my biggest pet peeves in nutrition is that everyone pushes water and water alone. especially in older adult nutrition, I'll say. And the reason is not because I have anything against water, obviously. Water is the best thing that we can drink. But quick poll, how many of you on this Zoom like to drink water? A few. Notice my hand did not raise.
Me
I
neither.
despise drinking water. I'm that person. I'm that person that has to like force myself all day, every day to drink water. I have to flavor it. I have to carbonate it. I have to do something. Like unless I'm actually like running or doing something active, then I'll drink water, but it's not, I don't like it. So I totally understand people that they say, oh gosh, I could never drink that much water because I hate drinking water. But what can't happen is that just means you don't drink. So if the choice is between not drinking or drinking a different kind of fluid, I will have you drink that other fluid all day long because the risk of being dehydrated is far worse than any potential negative outcome you're going to get for drinking some other fluid. Okay. So if your drink that you will drink to make sure you're hydrated is ginger ale, then we're going to drink ginger ale, right? So let's figure out what you will drink. Yes, would I like if at least half of that could be water? Yes, that would be ideal if at least half your fluids could be water, but they do not all have to be water. As long as fluids are non-alcoholic, so your wine and beer don't count, we can't count that, and decaffeinated. So if you drink coffee in the morning, that's okay, but if it's caffeinated coffee, you can't count that as a fluid, because caffeine actually has a diuretic effect. So caffeine makes you excrete more fluid. So it kind of cancels itself out. So you drink it, but then it makes you urinate more. So it's fine, but you can't count it. If you drink decaf coffee or decaf tea, you can count that as a fluid. So anything non-alcoholic and decaffeinated counts as a fluid. So your juice counts, your milk counts. If you have like bouillon or broth soup for lunch, that counts. Popsicles count, Jell-O counts, ice cream even to some extent counts. Caffeine-free soda counts. Is that the healthiest thing we could be drinking? No, but if we're talking solely about hydration, then I need you to drink whatever it is that you'll drink. So we would come up with a plan of what you will drink and figure out the times of day that we can get all those things in. And so, as I said before, just consider reasons why you may not be drinking. If it's that you think you have to drink water, then we can figure out a way to hydrate you without it having been consistently water. Another thing, just kind of as a like sidebar fact, you know, the soda stream carbonation, carbonated water, and like this right here. Let's do a show and tell. I hate water. So this is what I'm drinking. It's polar seltzer. It's calorie free. It doesn't have artificial sweeteners in it, so it doesn't taste sweet. It just has like a little hint of vanilla, but it's carbonated. And so because it's carbonated, in my head, I could drink this all day. But if this was straight water, I wouldn't drink it. So this is fine. This is not soda. The carbonation in water is not the reason that we get concerned about soda. It's all the other stuff they put in soda of why we don't like soda. It's the sugar and the chemicals and the phosphoric acid and everything else that's in soda that's bad for you. The carbonation itself is literally just air infused into the water. That does nothing. So I've had people sometimes tell me that they don't drink carbonated water because they know they're not supposed to drink soda. That is not considered soda. That's considered essentially the same as water. So if that's an option for you, then absolutely you can have that. I would actually even count this as water if I were you. Like I count this as water for myself. Just because there's air in it doesn't mean it's not water. And then if you're someone who really struggles, I will talk to people about how to get in those extra fluids from food. So like I said, soup, Jell-O, ice cream to some extent, even yogurt to some extent. Certain fruits like watermelon, for example, like they actually have quite a bit of fluid content. So if you really just feel like you can't drink enough, then maybe we can get some fluids from incorporating some of those foods into your meal plan as well. So thinking about that. So I guess from this slide, my main takeaway would be not everybody needs 8 glasses of water. So do that little calculation that I did for you. If you can figure it out, email me and I'll do it for you. And because I always like to give a range, I would say when I said to multiply your weight in kilograms by 30, I usually actually do 30 to 35 because that gives us a range of fluid that we can consume in a day. If it's really hot out and you're sweating and you went boxing, then maybe you need to drink a little bit higher in that range. If it's a day that it's cooler and you're just hanging out in your house, maybe you can drink a little less. So develop a plan. So do that calculation, figure out how much fluid you need on an average day. So again, remember that's an average day. If you are sick, if you are injured, if there's anything else going on, your fluid needs are going to increase. So that calculation I gave you is just for an everyday average of what you need. All right, that doesn't mean that's the most you would ever need. That's your average that you need. One of the best ways to then try to make sure you hit that is if you get a pitcher in your house, some type of container, or just like a bottle like this, that you can figure out exactly how much is in it, and fill every time you drink something from a cup, fill that cup with water and put it in the pitcher. And then that will help you track throughout the day how much fluid you've consumed and know based on that pitcher how much it needs to be. And then when you've hit that, you know that you have met your fluid needs for the day. So this is especially important if you're someone who's trying to not drink later in the day, to be able to gauge and know, okay, so I still have this much more to go and it's 1 o'clock in the afternoon, I better go get something to drink. So shifting the majority of your drinks to early in the day can help to decrease waking up at night if that's an issue for you. Minimize your intake of caffeinated drinks. So as I said, it's not that you can't drink them, but you can't count them. And if everything we drink is caffeinated, then how can we possibly drink enough that's decaffeinated, right? If everything you tend to drink in a day is coffee or Pepsi, then where will there be room for things that aren't caffeinated, right? We'd have to like hook you up to a water hose in order to get you enough. So try to limit how many caffeinated drinks you're drinking a day. Also, as with just general health, we want to limit how many alcoholic drinks that we're drinking in a day, if at all. 1 for women, maximum 1 to 2 per day for men. Choose foods that are higher in water content, like I spoke of a moment ago. And then also one of the main times that you can kind of optimize your intake is medications. So if you are someone who wakes up in the morning and has to take 12 pills, a handful of pills, make sure that at that time you are at least drinking 8 ounces, 8 to 10 ounces. You're probably going to need that much to get the pills down well anyway. So make sure that you are drinking at those times. Or sometimes I will have people, especially if you're someone with some swallowing difficulty, that will crush them and put them in pudding or put them in applesauce, and that's how they take their pills. That's totally fine. If safety wise or comfort wise, that's how you feel more comfortable, but you still need to drink it. So you can do that and take your pills in that manner, but you still need to make sure that you're drinking 8 ounces or 10 ounces with it. Another thing that helps with the tracking is, or just in general, is to keep something with you at all times throughout the day, whenever you can, to just sip on, because that doesn't make it seem quite as overwhelming if just every once in a while you have to take a sip of a drink, rather than sitting down with this giant glass and saying, all right, in the next hour, I have to drink this whole thing. So don't kind of psych yourself out either to make it seem like it's a bigger thing to overcome. And then this is the point in the class where if we were in person, I would serve you some delicious fruit infused drink to say, hey, look how delicious this can be. Hopefully we can get there. What questions can I answer for you based on all of this? Was any of this new information? Hopefully you all knew how important being hydrated is, but I think some people sometimes don't realize the urinary tract infection connection. That's a really big one, like really, really big.
Is that for both males and females, or?
That is, yes, both males and females. Yeah. Females have more of a tendency as we age to get urinary tract infections. So it might be especially crucial for women, but the hydration link is the same for women and men because it has to do with that bacterial buildup and the bacterial content of the urine. And then something I didn't really talk about, and we'll do a whole session in a couple of months on constipation, but I would say 8 out of 10 patients that I've worked with over the years that I was seeing for constipation actually weren't drinking enough. And that's likely the reason they were constipated. So your stool system, your digestive system has to have fluid to constantly move the solids through. And if it doesn't, then the stool becomes hard. And so then it becomes harder to move through. And so most of the time that I've ever seen someone, they might not be consuming enough fiber also, but in addition to the fiber, usually if I can get them to drink enough, they see a drastic improvement in their constipation levels. So that's another really big one that I try to make sure. And if you are increasing your fiber, you have to increase your fluids. Like absolutely, because you are going to create a giant fibrous blockage of a sponge in your digestive system if you don't also increase your fluids. So don't switch to whole grain bread or start eating like those Metamucil biscuits or anything like that if you're not also at least consuming one more 8-ounce glass of water a day. You have to give that fiber something to work with, or else you actually can make it a lot worse. So takeaway is drink for constipation. That's first treatment. What else? Did everyone figure out what your needs were? I know I kind of went through that calculation a little quickly. But yeah, for most of you, it's probably going to end up being anywhere between 1,800 to 2,600, guessing on who I see here. That would be my guess of where most of you would lie in terms of milliliters. So probably 6 to 8 glasses. All right.
Does coffee have the same effect?
Does coffee have the same effect?
Yeah.
So if it's caffeinated, no. Coffee is actually dehydrating if it's caffeinated coffee, because it causes you to increase your urination. So same as with alcohol, it causes you to urinate more. So it increases your losses, which is why I say it kind of crosses itself out. But what it does do is it takes the place of something that could hydrate you. So that's why I say to limit it.
When you say 6 to 8 glasses of water, what size glass are you talking about?
Like 8 ounces, yeah, a standard kind of, not a juice glass. Those are usually 4 to 6 ounces, but like a taller glass is usually like a coffee mug typically is 8 ounces. Nowadays, like older coffee mugs were small, but it's like the ones you can fit your whole hand in. Those are 8 to 10 ounce mugs.
Thank you.
Yeah. Also, there's at one point I had this really good, and I gave them away to another group. I should have saved them all for you. Some websites now have really good water bottles that actually have all the markings right on them that can make it super easy throughout the day to just kind of keep track. If I come across a place that I can get some of those, I'll bring those into the gym too. They're glass, so they can break, but they're good for tracking. All right. And then, like I said, next class, which I don't think we have a date yet, Pat, do we?
We don't, no.
Okay, so we'll figure out a date.
If you can stick with, Thursdays, 12:45, 1 o'clock, that'd be great.
Yeah, we should be able to.
Okay.
Throughout the summer. Yeah, throughout the summer, we can do that. So,
And you can think about it in person too.
okay, yeah, that would be great. So of you that are on right now, how many of you would come in person? Just show of hands. A couple at least. Okay, yeah. I mean, depending on the day probably, but yeah, that would be great. And we'll still Zoom it for anyone that wants.
Correct. Correct. That's easy.
Okay, that would be good. So next time class will be about protein intake, which I know is a big one for a lot of people. So we'll promote that one a little